Stress and anxiety certainly don't cause fibroids. However, many women who have fibroids or other menstrual problems, so period problems, can experience stress and anxiety because of it. There's no doubting that it makes your life far more complicated and difficult if you've got fibroids, because your periods become heavier, or it could have an impact on things like fertility, and therefore people with fibroids may be stressed and anxious because of it. Having fibroids doesn't directly affect your emotions. However, the symptoms that they may cause, such as irregular or heavy or prolonged bleeding, or difficulties with pressure in the pelvis and impact on your bladder or your bowels, those are the symptoms which then can cause emotional distress. But fundamentally, do fibroids cause emotional distress? No, they don't. It's the symptoms they cause which can contribute to that. Depression isn't directly caused by fibroids, but again, the symptoms that you experience, which can be very, very life-limiting and debilitating, can cause you to be depressed. Because if people's periods are very prolonged, if their activities that they can endure during a normal week are very much limited by the fact they're bleeding heavily or they've got discomfort within the pelvis, that can cause someone to be depressed. But fundamentally, do most women with fibroids have depression? Certainly not. Fibroids are essentially benign growths within the muscle wall of the uterus. They are hormonally dependent, which means that the estrogen that you produce during your periods, and that's a hormone produced by your ovaries, which actually makes you have ovulation and makes you have your period, those hormones can make fibroids increase in size. That means that fibroids generally only increase in size during your menstrual lifetime, i.e. from the age of 11, 12 or 13 up until the menopause at somewhere between 50 and 53. After the menopause, fibroids generally should shrink because there is no estrogen, and therefore the hormonal drive behind these benign growths has gone. The symptoms you get from fibroids can be due to bleeding, i.e. because the fibroids are impacting on the lining of the womb, and that can make your periods heavier or longer or irregular. But also fibroids can cause pressure symptoms because as they get bigger, they're pressing on other things within the pelvis. So they can press on your bladder, making you need to go to the toilet more frequently. They can press on your bowel, making it either uncomfortable to open your bowels or making it more difficult to open your bowels. But also the pressure of the fibroids within the pelvis can make sexual intercourse uncomfortable. My advice for patients living with fibroids is, first of all, don't worry. Fibroids are not dangerous. They're not going to kill you. They are extremely unlikely to turn into anything nasty like cancer. So please don't worry about fibroids. They're a very, very common finding. In fact, 80% of women will have fibroids at some stage in their lives. However, my advice would be respond to your symptoms. So essentially, fibroids can be involved with a number of different problems, such as bleeding problems or menstrual problems. They can be involved with pressure symptoms, where they're putting pressure on bladder, bowels, or during sexual intercourse. And they can cause, in a few cases, problems with fertility, particularly if the fibroids are preventing implantation within the uterus because the fibroids are located in a location close to the lining of the womb. So I would tell people living with fibroids, respond to your symptoms. If it's affecting your fertility, if it's affecting your periods, if it's affecting you in terms of pressure on bladder or bowels or sexual function, then get something done. Otherwise, don't worry about fibroids. They're benign and they're going to get smaller when you reach the menopause, and you only need to treat them if they're causing you adverse symptoms.